Good evening, everyone, and welcome to our dental health webinar. I'm Dr. Katie Williams. I'm the Technical and Product Development Manager here at Dengie. And tonight I'm joined by Ben Portus, a partner of Paton and the vet practice, who are based in Essex, not very far from us here at Dengie. In case you're watching one of our webinars for the first time, we do record the sessions, and Ben said he's happy for us to host it on our YouTube channel for you to watch at a later date. That will probably be on there from later this week, but you will get an email to confirm when it's gone live. So as I mentioned, Ben Portus is our guest this evening. He is an advanced veterinary practitioner in equine dentistry, and he studied at the University of Bristol, graduating in 2003. Incredibly, he also found the time to gain his private pilot's license, which I'm not quite sure how you managed to do that and be working as a vet as well, Ben, but a very warm welcome to you. And I think you've got some slides that you're going to share, and we've got I've already seen some of the images and videos, so we're in for a treat. But over to you, Ben. Thank you very much.
Thank you very much, Katie, and thank you to Dengie for inviting me along this evening. Katie, just a thumbs up if the audio is still okay. And you
it's all perfect.
I'm saying. Great. So welcome, everyone. Thank you for joining us for this webinar this evening. We're going to be talking about equine dentistry and addressing dental issues in horses. And please do pop your questions into the chat. Katie will interject if I'm either wanging on too much or she wants to add anything to what I'm saying. By way of introduction, I am going to share some slides and I'll probably dip in and out of screen sharing of those slides so that you're not just looking at them all of the time. Just to explain where those slides come from, I lecture to the final year vet students at the University of Surrey on equine dentistry. So I have slides that cover most of the conditions that we see in equine dentistry and also cover things like legislation, routine dental examinations and anatomy. So I'm going to start sharing the screen now, and hopefully, Katie, you can indicate that that's working. Why are we doing this webinar this week of all weeks? Well, mainly it's because that it happens to be Equine Dental Awareness Week that the British Horse Society has been promoting for a number of years now, specifically their No Pain, Check Again slogan that was developed by the Equine Dental Clinic and Chris Pearce down in Dorset. And what does this mean? It means that horses are particularly bad at telling us when there are dental problems. So your horse may have dental pathology that's very hidden. Horses have evolved to be very good at disguising dental pain and continuing to eat and behave fairly normally, even if they've got reasonably serious dental pathology. And so really the take-home message from today is make sure you have a suitably qualified person. That means an equine veterinary surgeon interested in equine dentistry, or an equine dental technician qualified and associated with either the British Association of Equine Dental Technicians or the Worldwide Association of Equine Dental Technicians, indicating that they have done some training and passed some examinations. Make sure that they are checking your horse's teeth at least once yearly to pick up early signs of pathology and be able to prevent problems becoming worse. If you just pop in BHS Equine Dental Awareness Week into your search engine, you will be able to find lots of information about the No Pain Check Again campaign and dental pathology in horses. Unfortunately, I think before we can go further, we do have to talk a little bit about the basics about anatomy, because horses have quite complex dental anatomy. When I show you my teeth, they are shiny and white and covered in enamel over the entire surface, and they're pretty simple. They're what we call brachiodont teeth or short crown teeth. Once they are there for life, and they don't particularly change. If I don't look after them, they rot and fall out, and I get dentures. Horses have what we call hypsodont teeth, which mean they don't have shiny white enamel covering the surface of the teeth. They have all three dental structures running through the teeth, and exposed on the dental surface, and their teeth are constantly wearing, as horses grind down tough fibrous plant material, they're constantly wearing down at the occlusal surface and erupting throughout the horse's life. So just to show you a little bit of anatomy here, and Katie, perhaps you can give me a thumbs up. Does the cursor show when I indicate that? Yeah, great. So this is an erupting mandibular cheek tooth schematic. And the blood supply of the mandibular cheek teeth actually comes from the surface of the tooth as it's a developing tooth bud. And the pale line around the outside of this developing tooth bud is the mucosa of the mandible, of the lower jaw. And then the bright red line that you can see is the folded enamel, the very hard, shiny white enamel that we have coating our teeth. On the outside of the enamel, we have soft yellow cementum in horses. In human teeth, we have cementum on our roots, cementing our teeth in place. Horses have cementum covering the outside of their teeth. And then the grey is dentine, which makes up the bulk of the tooth, with the live part of the tooth in the centre. That is the dental pulp that contains the nerves and blood vessels. And you can see as the tooth develops, the pulp chambers separate into separate tooth pulps. And horses actually have 5 finger-like pulps on each of their teeth, rising up towards the surface, above which on the occlusal surface they have black secondary dentine sealing the surface of the tooth, and you'll see that in a moment. So we can see in these schematics that the tooth then erupts through the surface. When it initially erupts, it's covered in soft cementum. The soft cementum very quickly wears away, and we end up with this peripheral enamel, so this bright red line just on the outside of the tooth with mandibular cheek teeth. So if I look through this schematic cross-sectionally, I've got the bright red, which is the enamel, and I've got blue, which is dentine, overlying and protecting the live, painful part of the tooth. And when I look with a dental endoscope, which is the best way to look at teeth and the most sensitive way of picking up pathology, this is what that looks like looking down on the tooth. So again, if you can see my cursor, these black areas are overlying the sensitive part of the tooth, the pulp. And then in red, I have highlighted here the enamel that is convoluted and folded and goes all the way around the periphery of the tooth. So it's called peripheral enamel. And then those are the blue areas, the secondary dentine. We've got soft yellow cementum on the outside, folded enamel running through the tooth, and then dentine on the inside of the tooth. Now, when we look inside a horse's mouth, the view is very much more obscured than that. So here's a nice picture. We've cleaned out the horse's mouth, and I'm taking this picture deliberately to be as clear as possible. But you can see that compared to the endoscope view, my view of this anatomy is very limited. And particularly as we get towards the back of the mouth, we can't see very much there at all. Now, when we look at the upper teeth, these are the maxillary cheek teeth of the horse, and hopefully you're all following this. This is slightly more complex anatomy. The maxillary cheek teeth are a larger, more square in cross-section tooth, and they have this deep infolding of what's marked here as bright red enamel. So this great deep infolding, they actually have 2 of these on each of the upper cheek teeth, and this is called the infundibulum. Again, the blood supply comes from the surface of the tooth as the tooth is developing. The tooth then erupts through the gum and initially has cementum covering it, which is nice and soft. It gets worn away very quickly. And then we end up with this cross-section of the tooth. And you can notice this occlusal angle. The tooth is set at an angle. And we've got enamel both on the outside, but also on this infolding on the inside of the tooth. So just to explain that anatomy a little bit more, and again, I've color-coded this. This time we've got bright red enamel, we've got blue secondary dentine overlying the live part of the tooth, and we've got green over the infolding or infundibulum. This is what it looks like when we look up at the tooth with a camera. So these areas here, these black areas, are actually folded in parts that were the outside of the tooth folded in on itself. Whereas these 5 areas, these 5 finger-like projections, are the secondary dentine overlying the live part of the tooth. Again, I've drawn the peripheral enamel here. You can see it's much less folded on the maxillary cheek teeth. It goes all the way around the outside, but it's not as folded. And then we've got a second ring of infundibulum enamel around that infolding. Hopefully that makes sense to everyone, but it is a concept that often people find confusing. And then we've got the blue overlying the live part of the tooth and the green overlying the infolded infundibulum. And again, when we look inside a horse's mouth, I've taken this picture to try and show it as clearly as possible, but you can see that towards the back of the mouth, we really can't see an awful lot. And I thought it might be nice to just stop the slideshow a minute and show a video of a normal dental examination in a horse's mouth. So I'm just going to play a dental exam video. Hopefully you can all see this.
Yeah, that's
thumbs
fine.
up if you can see it. Well done. Thanks, Katie. So this is, I'm trying to show you here a vet's eye view of the horse's mouth. And this is as good as it's going to get. This is with a sedated horse with the mouth completely cleaned out. The horse is resting its head on a headstand. And you can see I can't see anything between those upper teeth and the cheeks. The cheeks get completely in the way. I can't see anything between the lower teeth and the tongue because the tongue gets in the way. Here I'm just retracting the cheeks just to try and show the sharp enamel points that develop on the outside of those upper cheek teeth. But really the take-home message from this video is how limited my view of those teeth is, how far back they go, how big the tongue is. Tongue takes up vast amounts of space within the horse's mouth. And it just means that we are not seeing clearly all of the horse's teeth when we look inside the mouth. Now, my pointer now is just pointing out the anatomy. So that was the cementum, the peripheral cementum on the outside of the teeth. And then this black shiny area, it's like glass, is secondary dentine overlying the pulp. And then we get a second ring of enamel. And then this is the infundibulum. This is the outside of the tooth folded in on itself. So I can happily push the probe into that part of the tooth and it wouldn't hurt. Whereas if I pushed through the shiny black dentine, or if I over rasp the tooth through that shiny black dentine there, then I would damage the tooth and actually make the tooth painful and bleed and could end up killing the tooth. That's just pointing out the 5. And then on this tooth, there's actually a 6th pulp. And all the other teeth, there are 5 pulps, 5 of those finger-like projections, under which is the live, sensitive part of the horse's tooth. So what does this mean, the limited view there that we see? I'm just going to stop this video and then show another video which shows the use of a dental mirror. It basically means that we cannot do a full and thorough dental examination without A, having the horse sedated so that we've got a still target. You can see even though this horse is sedated, that tongue is still moving significantly. And B, without using either dental mirror or dental endoscope. So without the mirror, I can't see any of that black dentine on the lower jaw. I can't see any of this pathology. That as I run the mirror along, you can see how much more I can see there. So hopefully that explains a little bit about the anatomy. And then I just want to go back to my slideshow. You don't need to know about numbering teeth, but I would like to talk a little about routine dental management. I'm just pressing the wrong buttons on my slides here. And what's required and what we do when we're doing routine dental management. Now, remember, this slide is what I'm teaching to my veterinary students and to student equine dental technicians, but hopefully it's relevant and useful for you all to hear it as well. So number one, we need a suitable location, and that means in a confined space, ideally a stable, and ideally with either rubber matting or bedding floor, rather than a concrete floor, just in case under sedation we have any issues or the horse gets upset and slips during an unsedated examination. So I don't particularly like examining on concrete, and I certainly don't like examining in a open space where the horse can bugger off halfway through the examination with a gag on. It's a little embarrassing if that happens. They eventually come back because they can't eat when they've got a gag on. So now signalment and history, this is what I'll be taking when I start chatting to you when I arrive. And signalment I'll start before I even arrive by looking at the clinical history of the horse if we've got notes on the horse. But certainly the minute I arrive, I'm taking signalment. So I'm looking at the signalment means breed, age, and sex of the horse. And there are certain conditions that a horse won't have if it's an old male horse, where compared to if it was a young male horse. So an older horse is not going to have retained baby teeth, for example. So I can rule that potential problem out immediately if it's an older horse. Likewise, a younger horse is not going to have worn out teeth that are smooth and no longer able to chew properly. So signalment can be really important. We also have certain breeds that are overrepresented with dental pathology. So, for example, Welsh Section A's or miniature horses with quite small heads often have dental crowding, and that dental crowding can cause displacement or rotation of the teeth and lead to other problems like gaps between the teeth that food can get stuck in, causing periodontal disease. So signalment is important, and then the history for a routine dental examination is fairly brief. You might not even notice me taking it because I'll be asking how you are and how your holidays were, and trying to keep the horse calm throughout this stage. But I'll also ask whether the horse is eating okay, whether you've noticed the horse changing in behavior, dropping any food, dropping weight, and how the bitting is, how the droppings are, and a few other questions if we feel they're relevant or if the answers to the initial questions lead anywhere. And then we will again start the outside examination from the moment we arrive. So I'm looking around the stable to see if there's any dropped food, if there's messy food, any nasal discharge, and I'm looking at the horse immediately to see if there's any signs of pain in the horse's expression. We have this facial pain scoring technique that we use to see if a horse is trying to tell us that there's an issue. I'll be looking at the horse's demeanor, and I'll be looking at the face to see signs of symmetry or asymmetry, looking at the nostrils for signs of nasal discharge, and then I'll be feeling the horse's head. And the whole time we're just trying to keep things nice and calm, keep owners nice and calm so that horses remain calm. So a lot of that external palpation will seem like scratching and petting to keep the horse relaxed and keep everything safe. And then we lift the lips to examine the incisors. We will check the canines, which may not be present. They're not present in all horses. And we'll check the outside of the lips, the commissures of the mouth, for any pathology. And then we move on to the most important teeth, which are the cheek teeth. And the only way we can examine these cheek teeth properly, and I know I'm very small in the corner of the screen at the moment, but we have essential equipment that we must use to examine the cheek teeth properly. So I would urge you to question if your dentist or equine dental technician or vet doesn't have the equipment. I would urge you to say, oh, well, Ben said in his webinar with Dengie that you need to have this equipment. Why haven't you got it? And it may be a bit of an awkward conversation, but it may also persuade you that the technician that you're using or vet that you're using needs to up their game next time. So I think it's quite right to check, have they got a dental mirror, because you can't do a proper dental examination without. Have they got a gag? You need a full mouth speculum to be able to safely open the mouth and look inside and check the horse's teeth safely. Have they got a decent head torch? So the sort of AAA battery 5.99 job picked up from Tesco's is not going to cut it. You need something that's reasonably bright. You can see how bright that one is, because you've got to really get a bright light source inside that mouth. And hopefully you can see on the smaller screen that my head torch is at eye level, so that wherever I'm looking, there is a bright light following my gaze. And then finally, in terms of essential equipment, we need to be able to wash out the horse's mouth, either with a hose pipe or with a jet syringe, or with these plunger dental syringes, which is what I use. It doesn't matter which, but I want to look at the horse's teeth. I do not want to look at the horse's breakfast, and their food material will hide a lot of sins beneath it. So we wash out the mouth, we apply the full mouth speculum, we use a bright light source, we use a dental mirror. I also like to wear latex gloves because they protect my hands and they improve biosecurity. I don't want to spread germs from one horse to the other. And, you know, even if we're washing our hands carefully, using gloves is a good idea. And then we are going to use our hands and our nose and our eyes to pick up as much information about the inside of that horse's mouth as possible. So we are feeling and looking at all three surfaces of the upper and lower cheek teeth. We're smelling the breath, because rotten food material has quite a distinct smell. And we are looking at as much of the inside of the horse's mouth as possible. And then we will try and show you what's going on as much as we can. It depends how the horse is tolerating it, as to whether we've got time to show you everything, treat any conditions that need treating at the time, and then establish a plan moving forwards for further treatment. So this is me proving the point, because this is back when I had hair, look, or a bit more hair than I've got now, and this head torch is certainly not what I would recommend anymore. And you can see how old this is because I'm hand rasping here, and I certainly haven't had the energy to hand rasp for a long time. Rasps I use now are these motorized. Hopefully you can see that. I know it's on the small screen. Does that show up enough, Katie? Yeah. So this is a diamond disc with a motorized burr, and that's what we're mostly using now. But you can do a perfectly good job with hand rasps as well as with motorized rasps. It's the person using the tools rather than the tools themselves that are most important. So in terms of most common conditions, I'll just come out and skip a few slides more now, and I'm aware that I'm banging on, as I always do, perhaps a little bit too much.
No, that's fascinating.
I just don't want to give you the entire spiel that the students get, but I will at least show you some of the common conditions that we get with cheek teeth. So that's gone full screen again now, has it, Katie? Cheek tooth issues. We get both developmental conditions. Those are things that horses are born with, that are inherent to the horse, and then we get acquired conditions, things that develop over the lifetime of the horse. And this is the number one bread and butter common condition that is occurring in horses. And perhaps just to preempt some of your questions as to why should I bother getting my horse examined annually? Why will my horse need dental work doing when horses in the wild don't need doing? I think it may be worth just spending a couple of minutes talking about these sharp enamel points that develop. So horses in the wild have evolved to eat for 18 hours a day, and they eat very tough, fibrous plant material with very high silica content, quite abrasive plant material, in other words. And the horses have to use the entire occlusal surface of their teeth. So they have to grind right the way across the teeth and work really hard at it in order to grind that plant material down into 2 millimeter particles. And the reason they need to grind it down into 2 millimeter particles is because horses are what we call hindgut fermenters. They rely on bacteria in the cecum to break down the cellulose in plant material in order to release the energy that the horses need. So they're working really hard for 18 hours a day, grinding up this very abrasive plant material using the entire surface of the teeth to do it. So that's number one. Horses in the wild are not eating in the same way as our domesticated horses that are generally eating much softer fibrous material like cultivated hay, haylage, green grass, which is not a natural thing. Green grass is generally cultivated, and in this country is mainly cultivated for dairy cattle to improve milk yields. So there's not a huge amount natural about the grass that we have in the UK. And they're also being supplemented with concentrated food diets, which barely need any chewing at all, in order to improve their performance and energy levels and body condition scores. So our horses just don't have to use the entire grinding surface of the teeth or work as hard at it and then just not eating for as long each day. The second thing is that horses in the wild do develop very sharp enamel points, and it always fascinates me when I occasionally look at cattle, sheep, alpacas' teeth, which I do occasionally do. Those sort of farm production animals, their teeth are naturally incredibly sharp, sort of razor sharp. And horses in the wild certainly get very sharp enamel points that help with cutting and chewing that tough fibrous plant material. The big difference is that they don't have a bridle or a head collar put on that pushes the soft tissues against those sharp enamel points. They don't have a bit put in their mouth which pulls the soft tissues against those sharp enamel points. So the sharp enamel points that develop in our horses, unlike in wild horses, will lead to soft tissue trauma as soon as we do anything with those horses, because we push the soft tissues against them in an artificial and unnatural way. And then the last major reason we want to be checking our horses' teeth every year, whereas we don't check wild horses' teeth every year, is that we want our horses to live long and healthy lives. And our horses are regularly now outliving their teeth because they have hypsodont teeth that erupt continuously throughout their lives. I am seeing very often horses that have worn the teeth right down to the furcation of the roots. So the teeth have the 3 roots. Be careful how I do that, so I don't swear at you. And as they wear the teeth down to the roots, they actually get to the point where the teeth have no enamel. They only have cementum anchoring the tooth in place, and they become completely smooth and worn out. And those horses in the wild would long ago have fallen behind the herd and lost weight and not survived, whereas we want ours to live longer and prosper. So these sharp enamel points will develop in all domesticated horses, and they will develop fairly rapidly. In some horses, they will need removing more regularly than annually, but certainly we want to be doing annual checks at least. So if there is no other pathology, then on a routine dental examination, I will often be doing what I term a routine rasp of sharp enamel points. And this horse that we're looking at here would be included in that category. I'm just removing those edges, either with hand floats or with power floats. And this is what it would look like afterwards. Now, the main thing I want you to note about this after picture is that I have not touched the occlusal surface of these teeth. And I don't need to touch the occlusal surface of these teeth. They are supposed to be rough and ridged. There is supposed to be differential wear between the hard enamel, the very soft cementum, and the intermediate dentine, so that the surface of this tooth is rough like a millstone rather than smooth like a pebble. So if I slick this occlusal surface smooth with my rasp, I will just be reducing the amount of functional tooth that horse has, and reducing its ability to grind up food in the short term. So there is absolutely no need to do that. This picture shows sharp enamel points that have developed over the course of the year on the lingual aspect, next to the tongue of the mandibular cheek teeth. You can see how much the tongue limits my view of those points, but hopefully you can just make out the point here. And that's what it looks like afterwards. And again, I've just rounded that off and I haven't done anything to the occlusal surface of those teeth at all. Okay, I'm not going to keep going with these. Why does it say new share? What am I doing here? I want to stop share. Stop share. So I'm not going to keep going through the slides because I thought probably you would want me to answer some of your questions, and I've already talked for half an hour. So let me see if I can see this chat. So Katie has said, please put your questions in the chat Q&A. Are there different types of gags? Yes. So Rebecca, thank you. There are different types of gags. The different types of gags aren't really that important, though. They're often personal preference. What is important is that your equine dental technician or vet must use a full mouth speculum. That is, we don't want one of the gags that just goes in the corner of the mouth that the horse is right down on, and you can only look at the other side of the mouth while the horse is biting down on the gag on one side. We want a full mouth speculum, which means it has to have these plates in it that you put. I'm going to move my drink so that I don't spill everything. So that you put the horse's teeth in there, and then you open up the gag with a ratchet system, and you then look through the gap there. Now, there are lots of different ratchet systems, and there are lots of different looking gags, and they are everything from like Alu-Specs, which are lightweight aluminium, very highly engineered, posh gags that cost an absolute fortune, to sort of cheaper gags that you can buy on eBay that may be made of quite cheap steel, and occasionally they'll break while your hand is inside the horse's mouth. So yeah, what I brought in for the demonstration today, this is actually the pony gag, so it's very tiny. And ponies do prefer to have a pony gag fitted to them rather than the really big gags. We've got 3 of these patently, so we do share them around. We don't all carry them in our cars all the time, but we all have full-size speculums, and you can put the adult full-mouth speculums onto smaller horses. I've been told that my horse manages to get out of the gag. Sometimes if horses have what we call an overbite, so that's where their incisors sit one in front of the other, they may, the upper teeth may fit nicely in the gag and the lower teeth may slide off. Some horses are just very good at chomping on the gag until it falls off, and it can be quite scary. And some horses, if they've got little ears or very large crests, they tend to get the strap of the gag off from above their ears. So that's just down to technique for your equine dental technician or vet, but it can be a bit tricky sometimes. I think that's most of the comments that have come through on there. I have got some questions that came through earlier. Katie, we've talked about sharp enamel points. The question is, what are the most common dental issues? So beyond sharp enamel points, the most common dental issue would be an exaggerated transverse ridge. So that's where the horse's teeth go along like that, and then you get a large ridge. And that can cause problems if that large ridge is going down into a space between the 2 teeth below, because it can wedge down into that space below and cause what's called a diastema. And diastema is just a vet's way of saying gap between the teeth. That is another very common condition in horses, and it can lead to, and Susie has asked this question about diastemas, so that was a timely question, Susie. Diastemas are gaps between the teeth. I'll show you a slide here because I think it's a useful slide to show when it comes to diastemas. Are you still seeing my screen there, Katie?
Yes, we are. There's
good.
Scrolling through. And...
Right. Is it? Are you seeing it spool through on the left-hand side?
I am, yes.
Yeah,
Yep.
fine.
That's
So,
it, yep.
so just to explain diastomers, a horse's teeth should, cheek teeth this is, the 6 cheek teeth at each quarter, which you can see in this X-ray quite clearly, those 6 teeth should act as a single functional unit. That is, when you look along those teeth, it should look like one tooth. You shouldn't be able to see where one tooth ends and the next tooth starts, because they should all push firmly together. And the reason that works is because if you look at these back teeth on this horse, they angle steeply forwards. And if you look at the front teeth, they angle reasonably backwards. And all of these teeth are erupting continuously. And as they erupt, with the back one angling forwards and the front one angling backwards, they squeeze themselves together, as shown by this green arrow here. But if that system breaks down for various different reasons, those teeth stop functioning as a single unit and food starts to get in between the teeth. And the problem is that horses eat really tough fibrous food, and we've all had something stuck between our teeth before, so we know how irritating that is. Imagine if you ate hay or short chop fibre chaff, and it got stuck between the teeth and you couldn't work it out with your tongue, because the gap was too narrow and was pinching that food material, and then every time you chewed, you forced that food deeper and deeper and deeper between the teeth. What would then happen is, A, that food would force its way down into the gum line, B, that food would begin to rot, and you would get bacteria digesting and breaking down that food as it rotted, and that process of bacterial digestion produces acid. And the acid then causes more tooth decay on the surface of the teeth, but also causes more periodontal disease or soft tissue disease to the gums. And that can become a very painful condition. So that is another very common condition. Sometimes it can be difficult to see in the first instance. So we're looking along the lower jaw and you can just get an idea that there's wispy bits of food here stuck between this horse's teeth. But when we look with the mirror, and again, this is why the mirror is so important, you can now really clearly see that these teeth are slightly displaced from one another, and they're not in a nice straight line, and food material has managed to get caught in the angle between those teeth. And this is now looking with a scope. This is actually my old scope. It's quite an old slide. And you can really clearly see the food material stuck between those teeth there. So Susie's question was about how do we best treat these diastomers, and I find these one of the most frustrating conditions to treat. The first thing we need to do is, this is going to be a sedated treatment, is the first thing to say. I've got the occasional horse that will allow me to pick out the bulk of the food material unsedated, but to do a proper job with these, this is sedation. And then we use these dental picks or files to pick out the food material, and we can also use water picks, as you can see in this slide, to flush out the food material. Hopefully you can all see that with the food flushing out. So that's the first thing we've got to do, is we've got to get this gap clean, because it's only when we get the gap clean that we can assess why has this gap formed, and it's only when we can assess why the gap has formed, what sort of gap it is, that we can then make a treatment plan to try and prevent this food from going in the gap and causing more periodontal disease. And there are various different classifications that we give to these diastomers. And the one that we all dislike the most is what we call a valve diastema. So if you imagine the tips of my fingers are the occlusal surface of the teeth, and this is 2 teeth pushing together, they should be firmly sealed like that. But in this case, there's a slight gap. But down at the gum line here, where my thumbs are, the gap is much wider because of the angle of the teeth. And what happens is food material goes in through the narrow gap on the surface and then starts to pack in this wider chasm down at the bottom. And once it gets trapped, it's a bit like a one-way valve. More food can go in, but the food that's got in there can't get out. So it pushes deeper and deeper and deeper into that gap. So one of the ways that we treat valve diastomers, and we would only be able to assess those once we've got the gaps clean, is to do what's called diastemal widening. We basically, paradoxically, in order to treat the pain and periodontal disease, we sort of admit defeat and say, right, we're not going to cure this gap. We're just going to open it up. So we remove dental material as little as we can possibly get away with to open up the gap and turn it from a valve where the food goes in and can't get out into an open diastema where the food can recycle through the space and the horse can work out that food material with their tongue. Sometimes we'll use dental bridging. This is a little dental bridge you can see on the mirror here using polysiloxane vinyl, which is a rubber type material. And this acts as a bandage effectively to just keep food out while the gum gets a chance to repair. We don't generally do permanent bridges between the teeth because these teeth are constantly erupting. So the problem with a permanent bridge or a hard bridge is that you'll put it in place and seal things nicely, but as the horse's tooth erupts, it will push that bridge up and a space will open up underneath it and food will then still get stuck underneath. And with permanent bridges, they often break down anyway because of movement between the teeth as the horse grinds the food material. With human dentistry, we can place bridges and then ask our patients not to eat hard, tough, fibrous material so that they can look after their teeth better. And obviously we can use interdental brushes and picks and floss to keep these spaces clean in humans. So the human dentists have got it easy compared to us. So yeah, in answer to your question, Susie, it will be on a case-by-case basis with regards to diastemas. We have to clean them out and then assess. I hope that answers that question on diastemas. What are the best things to clean them with? So, Susie, you may have meant what can you do to clean your own horse's diastemas? And I think that's a really important point. And one of the frustrations I have is that often I'm not curing these conditions. I'm doing my best to help them, but then I'm leaving owners to do the rest of the work. And I often describe it as, I say to owners, oh, this is teamwork, but you're going to do 90% of the work and I'm going to do 10% of it. Because as owners, you can do the day-to-day management that's so important for improving oral hygiene. So what's the best thing to clean it with? The best thing to do is to just use water to improve the oral hygiene by flushing out that mouth once or twice a day if you can. It will depend on the horse because some just don't tolerate it. And the last thing you want to do is turn your horse into a head-shy horror that the minute you arrive at the yard, they think, oh, here they come with the hosepipe again. I don't want to go anywhere near my owner and I hate this person. It's fine if they hate me because I'm only going to turn up once or twice a year, but I don't want them to hate you. So bulk cleaning the mouth daily if possible, or as regularly as possible if daily is not possible, I think is really useful. It just softens and removes the plant material that has adhered to the teeth and got stuck in those gaps as best as you can, and gives those teeth a break from constant bacterial fermentation to try and improve the oral hygiene. We are moving away a little bit from chlorhexidine rinses, although they do have their place when we have nasty bacteria within the horse's mouth. There is a lot of work at the moment going on into the biofilm of the horse's mouth. That is the healthy, good bacteria that cling to the surface of all of our teeth and also cling to the surfaces of our horse's teeth. And the research that's coming out suggests that this is a very complex area and that we need to be very sensitive to the healthy, good bacteria when we think about killing the nasty acid-producing, decay-causing bacteria. So there are chlorhexidine rinses out there. I have used them with some success in the past, and I will use them where I have very active cavities forming on horses' teeth. But they're not particularly good for the environment, and they may be killing good bacteria as well as bad bacteria. So flushing out that horse's mouth with water, Susie, and the other thing you may need to do if your horse has got diastema is change the diet off short chop fibre onto a pelleted feed. with diastema, short chop fibre, that is, chopped up little pieces of straw that look like chaff, they're often the worst for getting in those gaps and then being stuck because the horse can't work them out with a tongue or with a normal chewing cycle. So very often if we have a horse that's developing gaps between the teeth, we will get them onto a pelleted feed. And Katie will be able to put her microphone on and tell us which pelleted feed Dengie do that would be a suitable sort of fibre replacement pellet or a whole hay replacer.
Yes, so you've got a couple of options really. We do a pure grass pellet, which exactly as the name implies, it's just grass harvested when it's immature, so not a hay pellet, it's a grass pellet. So it is quite high in sort of naturally occurring sugars, but it is the most natural form of sort of grass replacement or forage replacement. We'd also have things then like alfalfa pellets and also an alpha beet. So we often use a combination of those depending on the horse's requirements, because the alpha pellets are much lower in sugar. And you might use a high fibre cube, traditional one to mix with that. So yeah, it depends on the individual's weight, condition, things like laminitis history, that we'd pick a combination of those sorts of things, soak them up and make a nice, soft, easy to chew mash.
Thank you, Katie. Defer that to your more expert knowledge. Susie's just added that the her diastemas are between the incisors. So we do see quite nasty diastemas between the incisors. Again, management of this is 90% owner and 10% me. But I have got some slides, Susie, that I can show you. Slightly worried about pressing escape and then cutting off the Zoom, which I don't want to do. Let's show you some nice incisor diastema slides. Here we go. So this is what we're talking about, Susie, then with your horse. This is quite a severe example. Again, the incisors, there are 12 of them, so 6 top, 6 bottom. They should work as 2 functional units. These teeth should all push together and there should be no gaps between them. But the incisors taper towards the root. So as they erupt over the horse's lifetime, not only do those teeth lengthen, but they tend to develop gaps between them. So this tends to occur more commonly in older horses. Here you can see this horse has got lots of food material stuck in the gaps. And this is what you might be seeing, Susie. And if the horse lets you, there are various things you can use. If the horse is really not very happy about it, then probably using a fairly soft sponge with tepid salty water is going to be the best you can do to try and wipe this food away. Certainly using your fingers to pick out the food material is worth a go. Again, depending on how tolerant the horse is, don't do it before a hot dinner date because your fingers will stink for the rest of the day. Because that food material will be smelly and rotten, or wear the gloves. That's the other reason I wear gloves all the time. And even with those, I often stink of rotten horses' teeth. So the next stage, so sort of going up in severity, if you like, of treatment and effectiveness of treatment, the next stage would be to use a denture brush. And some horses tolerate this really well. And you can just use a denture brush. I normally have mine in my bucket, but it's not in there at the moment, so I can't show you. But essentially, it's what we use for cleaning dentures when we get older. You can pick them up from Boots for nothing, a couple of quid, or an old toothbrush. Or if you're not talking to your husband at the moment, use his toothbrush and then pop it back without telling him. Either of those options are good. And then we sometimes do use those files that I showed you earlier to pick out the food material. The problem in doing that with your own horse when it's unsedated is that if you stab the gums, it will make them bleed and be a bit sore. This is that same horse. Now that we've cleaned out all the food material, you can see the extent of the gingival recession. The gum has receded back a long way. But if we can pick this out and clean it regularly, then those gums will heal up and be less sore. And it is something I'm fairly proactive about now. Here's another diastema, and this horse was very upset about the idea of having these gums cleaned out at all. You can see how the gap between the teeth between the normal teeth here, you've got a nice V-shaped point of gum, and that's what it should do. It should be sealing that tooth down towards the occlusal surface. But here the gum's receded right back, and you get an idea that there's a bit of thickening here from that inflammation. On this particular case, I did do a permanent bridge. So I cleaned up the tooth on the surface, and then we placed a permanent bridge because this horse just wouldn't tolerate having that cleaned on a regular basis at all.
Are these older horses, Ben, or are they?
This one, oh, sorry, I don't want to close that. This one, I don't think it was particularly old, teenager. This horse was very old, yeah.
Yeah.
This is long in the tooth. And it is, the incisor diastemas do tend to occur in older horses. Yeah, so Elaine used an ordinary toothbrush to brush tooth out from the front. I think that's perfectly sensible. You will make the gums bleed occasionally if you catch them. Don't panic about that. That bleeding often does stimulate healing if you can then keep the food out. But they won't heal if you can't keep the food out from them. But it's definitely worth trying. I think it is well worth trying. Yeah, in terms of improving oral hygiene, if you've got diastemas or peripheral cemental caries or cavities in the horse's mouth, then yes, you can put a normal hose pipe in there. Some horses really like it. Some horses don't tolerate it very well. You know, some will really play with the water and enjoy it. But as I say, I don't want anyone to upset their horses doing that. You can pick up these dental syringes. We sell them at the practice, but you can buy them on Amazon. Or, you know, just pick up a horse dental syringe, and then you've just got a bit more control than you have with the hose pipe. It doesn't tolerate it. Christine's asked, when there is a missing tooth, is there a reason we don't remove the opposite one? Yeah, I mean, we don't. When there's a missing tooth, what will happen with the opposite tooth is it will grow up into the gap. The tooth will continue to erupt unopposed. It won't be worn out at the same rate as the other teeth that do have a tooth opposite, and the tooth will wear out. The main reason we don't remove that tooth is because removing teeth is an invasive, expensive surgical procedure. And what will happen if we do remove that tooth? That's a perfectly healthy tooth. It's just that the tooth opposite has gone. That tooth is erupting perfectly normally, and it's growing up into that space. If we remove that tooth, then the teeth either side will drift into the space that's left behind by it over a period of time. And as soon as they drift into that space, they will then not have a tooth opposite them, so they will start to overgrow. And you will still have to keep those teeth down with your routine dentistry each year. And as those teeth drift in, there's an increased risk that gaps begin to open up between the other teeth. So you get this domino effect. So it is certainly contraindicated. We do not want to remove healthy teeth just because there's a missing tooth opposite. But what we will absolutely have to do in those situations is we will have to rasp down the overgrown tooth on a regular basis. What happens if we don't rasp down that overgrown tooth? Well, it will begin to push food up into the space opposite. So you've got a gap opposite, and the tooth will begin to push food up into that gap. And that might not be a problem initially, but eventually, as the overgrowth gets bigger and bigger, it will begin to push food into the healthy, healed gingiva where that missing tooth has been removed. It will also, if we don't routinely keep that tooth rasped down, it will get to the stage where we're unable to reduce the overgrowth in a single session. So whenever we're removing overgrown, whenever we are reducing overgrown teeth, focal dental overgrowths, we have to be mindful that below that overgrowth, there is live sensitive tooth. And if we rasp down into the live sensitive structures, A, we cause immediate pain, but B, we will cause what we call a pulpitis. So by rasping down into the sensitive pulp of the horse's tooth, that will lead to inflammation inevitably. Now, in some cases, we will get away with it. The horse will develop an inflammation of the pulp, and it has a mechanism whereby, with a good blood supply, it will lay down what is the scar tissue of the tooth weld, which is called tertiary dentine, and it will seal itself off again. But we absolutely cannot assume that the tooth will repair itself successfully. What may happen is that when we get a pulpitis, an inflammation of the pulp of the tooth, swelling occurs, and the swelling may cut the blood supply off to that tooth pulp, and as soon as we cut the blood supply off, we then get pulp necrosis. So we've gone from exposing a pulp accidentally by over rasping the tooth to killing the tooth, and then bacteria will track up the necrotic pulp towards the tooth root, and we end up with a tooth root abscess. So that would obviously be a big problem. I hope that answers Christine's question. Seeing if there's other questions on here.
Another one in the Q&A about a lower swelling from teething, really, even in a 4-year-old. Is that something you?
Yeah. Why does my raising 4 still have lower swelling from the teething? Because the teeth are bigger than the mandible, Kathy, and it's as simple as that. And people get very upset about this in young show stock. But the tooth buds can be enormous, and they will cause bumps on the mandible, and those bumps will go down as the teeth erupt on the occlusal surface and as the mandible matures and develops. But as long as those tooth buds and the roots of those teeth are bigger than the mandible itself, you will have bumps on the lower jaw. And equally, the reason that young Shetlands, miniature horses, Welsh Section A's particularly, have very flat, square faces is because the teeth are larger than the maxilla on the upper jaw. The teeth are so big that they essentially stick out, just like the bumps on the lower jaw, and make their faces very square. And in young horses with very large maxillary teeth that deform the maxilla and make the face very square, they can also get problems with their tear ducts and with their sinuses, because the teeth displace the normal anatomy of the face as they develop. But generally those problems resolve over time, and I'm afraid, Kathy, you've just got to be patient. There's no shortcut on that one. What bit would you recommend for a miniature horse for driving, as their mouths and teeth are so small? You have got to apply first principles for bitting, and you've got to make sure that bit fits. So with miniature horses, Kathy, you may have to go specialist. I'm not an expert on manufacturers of miniature horse driving bits, I have to be honest, but the principles of fitting that bit to a miniature horse are identical to fitting it to an adult horse. So you want a small amount of the bar of the bit sticking out on either side. You want the cheek pieces on the bridle to pull that bit into the commissures of the mouth, so the bit is snug and secure with 1 or 2 wrinkles in the commissure. You don't want the bit to be too wide so that it can slide from side to side inside the horse's mouth, but you don't want it to be so tight that the rings of the bit are pulled into the pony's mouth either. I've honestly no idea who manufactures miniature horse bits. What I do know from treating miniature horses, unfortunately not that are driven, but that are shown, is that a lot of the miniature horse stuff has to come across from the US, where the breed is much more numerous and popular. So you may need to wait for it, unfortunately. Cool. I don't know if we've got additional questions, but I'm quite happy to.
I was going to ask you, Ben, along the theme of the sort of slightly different anatomies and sizes and shapes, could you just sort of comment on the donkey and how that would differ to horses and ponies? I know we have got a donkey owner in the audience this evening, so that would be an interesting area to look at. Yeah, absolutely. So the main thing about donkeys is they are not miniature horses. So the donkey digestive system is very much more like a cow or a camel's digestive system. And
don't mean that in terms of the anatomy. I mean it in terms of the donkey's ability to get lots of energy out of very poor, very fibrous food material. So generally speaking, the problem we have in this country with donkeys is that they are managed like small horses, and they are fed on a grass and hay diet, when what they really need to be on is a much higher fiber, lower sugar diet. And so straw, wheat or oat straw, is a better food material, forage material for donkeys than hay. It is quite a complex area. There's good research going on at the moment by the Donkey Sanctuary down at Sidmouth. And for anyone who wants further information about feeding donkeys, the Donkey Sanctuary website does have some really superb handouts, one of which is here. This is just their fact sheet on feeding donkeys. And that will give you some really good information. Obviously, as with horses, unfortunately, it's a bit boring. You shouldn't be feeding sugary treats. And with donkeys particularly, they will get a lot out of sugary treats and become quite overweight quite quickly. Interestingly, the Donkey Sanctuary, for donkeys that develop poor dentition, poor teeth, they actually recommend moving from long fiber hay or straw to short chop fiber for those donkeys that have got poor teeth, worn out teeth, or problems with chewing hay or straw. That's slightly different from the advice we would give for horses, particularly if horses have got diastemas. We tend to get them off short chop fiber, but keep hay going. But the Donkey Sanctuary, who have got a wealth of experience in this area and certainly know a lot more about feeding donkeys with bad teeth than I do, recommend going from long fiber if donkeys are struggling onto chaff. And I guess, again, that's because they're just worried about feeding concentrates to donkeys and too much weight gain. I hope, Katie, that answers that question a little bit, although I am aware that I've thickened out slightly by just pointing out the Donkey Sanctuary's excellent.
Yeah, well, they are fundamentally the gurus on all things donkey, aren't they? So they're a great resource, and they did a lot of presentations actually at Beaver Congress this year on utilising straw for donkeys, just as a forage source to kind of keep their teeth in good condition so you can basically give them fibre without too many calories. So short chop versions are perfectly fine to use, because donkeys are such good doers. So even when they're losing their teeth and things, they can still hold their weight extremely well. So assuming they haven't got diastemas where it's going to pack, obviously, if it's just other issues that are causing them to struggle with the long length, then short chop forage is useful.
I think really important as well to remember, if you've got donkeys, they still need that annual dental check. So they will be even more stoic than horses when they have dental pathology. They won't show you signs of pain. They will just carry on stoically chewing on their painful teeth. So that annual dental check is still really, really important for donkeys, and often overlooked because condition score wise they're doing well and they seem happy in themselves. So they do still need the annual checkup.
Yeah. Good. I think there was actually a paper published a few years ago to show, and again, you might have a view on this, Ben, but with horses, the length of forage or particles of fibre, if they're coming through in the faeces, in the dung, the sort of threshold is supposed to be 3.6 mils, gives you an indication there's a dental problem.
The problem, yeah. And they're not digesting that food properly.
Yeah, with the donkey, they were suggesting that it should be shorter than that at 3.3 mil, which it was nice that they'd actually researched and thought about the comparison, the contrast between the two and compared them. But I don't know if that you probably see other problems before you need to go rummaging around in their poop too.
Well, yeah, and I think donkey droppings do tell you a lot about how well and how efficient their digestive system works, because they're very hard and dry compared to horses. So it does give you an indication that their intestines are extremely good at getting everything out of the food that you're feeding them. And yeah, absolutely, if particle size is increasing, that is an indication that there could be a problem with their chewing.
And like you said earlier at the beginning, good sort of awareness, good horse management, isn't it? Spotting signs that anything that's changing that's not normal is your kind of warning sign, isn't it, really?
Yeah, quite
brilliant. I think we're coming to the end of the questions, so we've been the sort of hour we're allotted, so I don't know if there's anything else you want to mention, Ben, but otherwise I'll probably draw the webinar to a close.
Well, yeah. The problem with me is that I could wang on about this forever, and I'm aware that I haven't talked about every dental condition. I haven't gone through every question that could be asked, and so it's been a limited talk in terms of picking up some areas of interest and some of the questions that have been asked. But this is not a comprehensive covering all of the dental issues that you're going to see. I think just to reiterate the take-home messages, that a thorough dental examination once a year is vital for all of our domestic horses. That's really important, and that needs to be done by a suitably qualified person that has the bare minimum equipment required to do a dental examination: a bright head torch, a full mouth speculum, some way of flushing out the mouth so they can see the teeth, and ideally a dental mirror or a dental endoscope, so they can pick up pathology that would otherwise not be recognizable. Just being aware that your horse will not tell you if it has got dental pathology until that dental pathology becomes very severe. The horse will just put up with toothache and not tell you.
Brilliant. Well, thank you ever so much. I think it's been a really good overview of the most common issues and the sort of really practical advice that people can implement themselves. So, which is, as horse owners, what we need most. So, thank you very much indeed for that. And yeah, hopefully we'll all get together again, maybe in the spring, and talk about some other issues. But in the meantime, the recording, as I said, will go on to the Dengie YouTube channel probably later this week. If you have any follow-up questions, do email us. It's feeds@dengie.com. And yeah, hopefully we'll see you at another webinar soon. Thanks all.
Thank you all for coming along. Thanks, Katie, for hosting. Cheers.
Thanks, Ben. Bye.